Good evening, everybody. Welcome to our second session of our three-part summer series on holistic medicine. I hope everybody is doing well this July evening. I am super excited about these topics that we have for our summer series, and tonight I think there is definitely a lot of interest in us talking about acupuncture, mindfulness, and pain management. But before we jump into discussing our topic for this evening and introducing our guest speaker for tonight, I just want to take care of a few housekeeping items. Of course, we love when you enter any questions that you might have into the Q&A box so we can answer those questions as we're going along. This is a 1 hour session, so we only have until 7 o'clock. And I know again that this is a topic of great interest, so we'll probably get quite a few questions. So unfortunately, we'll only be able to answer the questions that we have in the time frame allotted. Worst case scenario, I can maybe knock on Dr. Lorbeck's door and ask if we can get some of those other questions answered. But to kick us off, briefly, I wanted to include Dr. Tyler Kaplan from the Rush MS Center to give us a quick update on the CLIP MS study that is being conducted there at Rush. And then I will be happy to introduce our guest speaker for this evening. So Dr. Kaplan, I'm going to have you start us off.
All right. Thank you very much, Kathy. So very happy to get on here and talk some more about some of the different projects we have going on through the Brain Health Program here, and specifically to bring up the project that I'm currently the primary investigator on, our CLIP MS study. We've talked about this in a couple other meetings with some of you who may not have attended those meetings or may not remember what we talked about. So the CLIP MS study stands for Comprehensive Lifestyle Intervention Program in people with multiple sclerosis. So this is a unique pilot project we're running that was we're able to do through a very generous grant through a charitable foundation, the Margaret and Charles Roberts Foundation, which is specifically designed to investigate holistic approaches to improving patient outcomes. And so it fit very well with ultimately what we're looking to accomplish through the Brain Health Program. We had our first session back in June, and we had 7 patients enroll in the program. And we have our second session coming up here in August. And so anybody who is interested, I highly recommend reaching out to us to get more information. We have a few slots still available, but there's a lot of interest right now. So just as a very quick overview, this is essentially kind of like a sampler platter of everything that we have here at the Rush program, but they're all kind of put together in one organized fashion so patients can really get the full breadth of experience here. So it starts off with our 3-week interactive online virtual educational series. And then patients will then have interactions or appointments with our nurse practitioner, Adrienne Castillo, in our brain health clinic to go over lifestyle interventions for every 2 months over the course of a year. And for the people involved, that will be checking different measures of overall patient quality of life and doing surveys to see, really try to quantify how much these programs are helping our patients so that we can continue showing the science to continue to promote research in this field going forward. So just for patients who may wonder, so it's the criteria are fairly simple. It's patients who are 18 years or older, who have a diagnosis of multiple sclerosis and are currently being cared for at the Rush MS Center. So it can be any form of MS, whether it's relapsing or progressive, and it doesn't matter which specific medication you may or may not be on. The only restrictions, if you will, is that we are not enrolling patients who have already done the 3-week educational course or patients that are already being seen in the brain health clinic with Adrienne. We want to have patients who are new to the experience so we can actually try to quantify the benefit for patients. But certainly we can put the contact information in the chat below, but our research coordinator who's on the call is Jules Skoda. and she can put her email in the chat, or we can send that out to patients. So anybody who might be interested, I highly encourage that you give us an email, and we'll get back to you right away and can talk to you about what the program entails, and if you do want to take part, we'd be happy to have you.
Fantastic, Dr. Kaplan. And I already have somebody in our chat box who has indicated they would be interested. So
All right.
um, also, I'm happy if folks are not knowing how to get a hold of Jules Skoda, even though I think she just put in here as well as to. Yes, perfect. But anybody can also reach out to me, and I oversee that 3-week masterclass. So happy to get folks set up and coordinate with Jules as well from our research group. So thank you, Dr. Kaplan, for giving us that overview. That next 3-week MS masterclass on brain health will be starting Tuesday, August 12th. And like I said, it's a 3-week program run on Tuesday and Thursday evenings, same time as we're running our conversations on brain health. So from 6 to 7 o'clock for those who are Central Time, 5 to 6 p.m. Mountain Time. So very good. I appreciate you giving that overview for us, Dr. Kaplan. Thank you.
Absolutely. Thank you. Happy to talk to everybody.
So on that note, I am going to turn things over and have us jump into our topic for this evening. I want to introduce our special guest for this evening, which is Dr. Angela Lorbeck. So honored to have her be a part of this our conversations on brain health, and I think this will be a wonderful evening of discussion as she can kind of dive into her specialty and give us some great insight. So a little bit about Dr. Lorbeck, and I was reading over her bio, and it is very impressive. So she is an integrative oncology specialist with over 22 years of experience in academic integrative medicine, including 18 years at Rush MD Anderson Cancer Center. 18 years, that's quite impressive. Her work at Rush has focused on pain management and clinical supervision, including the training of acupuncture students through her long-standing collaboration with Pacific College of Health and Science. In addition to her clinical role at Rush, Dr. Lorbeck runs a private acupuncture practice in Chicago, specializing in both pain and stress management. She is also a certified functional medicine health coach and mindfulness educator, offering personalized coaching and group programs that help individuals take charge of their health, build resilience, and thrive physically, mentally, and emotionally. As a founder of Insight Wellness Solutions, Dr. Lorbeck also develops and delivers science-backed wellness education for diverse audiences, from patients and caregivers to corporate leaders and healthcare teams. A TEDx speaker known for her clarity, compassion, and credibility, she blends evidence-based mind-body strategies with real-world practicality. Whether through keynotes, workshops, or multi-week training programs, her passion is helping people and organizations reclaim their energy, rewrite their health stories, and lead with purpose and presence. It is an incredible honor to have Dr. Lorbeck with us. Thank you so much, and we're all super excited to hear a little bit more of all of this that you have put into practice. I'm sure our audience is very excited to hear from you. So thank you.
Well, thank you both so much for this just wonderful opportunity to be with you tonight and to share some insight about acupuncture. I'm really honored to be part of your community.
Excellent. Well, thank you, Kathy, for that introduction, and thank you, Dr. Lorbeck, for agreeing to be here. And I'm sure our audience already understand why we are so excited, because this is exactly the type of conversations we want to bring forward into this series, which is ultimately lifestyle interventions or holistic care that perhaps we are now starting to understand and have evidence behind that we can actually recommend and understand how to incorporate into our armamentarium of options for our patients. But behind these strategies, we would like to have someone like yourself that truly understands and has
Mm,
competence in
mm,
how to apply that. And I will say acupuncture has been one of those areas that, as a provider, I always wanted to incorporate, but I always felt that it's pretty dependent on who is the person actually administering these techniques. So that my first
yeah.
question for you, Dr. Lorbeck, is maybe if you can explain to us what is acupuncture?
Sure. So that's a great question, a great way to begin and kick off this conversation. So, acupuncture is a form of traditional Chinese medicine. It dates back to about 4,000 years old. And it was introduced to the United States around the 1970s. And ever since, it's kind of gains great credibility as more research studies have come out to show and to demonstrate its safety and effectiveness. But essentially, it is the gentle insertion of very fine, sterile filament needles, very flexible needles into the skin at various acupuncture points on the body. And there are a few hundred acupuncture points on the body that are from the top of the head to the bottom of the feet, the front of the body, the side of the body, the back of the body. And they line up along these meridians, or you can think of them almost like highways. And so there's the gentle insertion of the needle into the skin, and then that's when the magic happens. So typically with acupuncture, there is a specific kind of combination or recipe, if you will, like an acupuncture prescription that I'm using with every single treatment.
Excellent. And, it seems like, when I look at the historical aspect of the use of acupuncture in multiple sclerosis or in neurology in general, our audience here is very diverse. We have many patients with MS, but also, neuromyelitis optica, spectrum disorder, and other related disorders. And it seems like the areas that perhaps was most utilized was pain management.
Yes.
And we know that up to 70% of MS patients will experience pain at some point. We also
Hmm.
know that that pain, it's not just due to one issue, but perhaps it's a manifestation of multiple processes going on, anywhere
Mm,
from inflammation or secondary to spasticity or pain that comes from the nerves directly.
mm,
So what has been your experience with the use of acupuncture in MS or in pain management? And
mm,
second part of that same question is, what is the actual scientific evidence that
mhm.
supports the use of acupuncture in the management of pain?
Yeah, that's a great question. So, I would say, just in general, in my 18 years of practice, Dr. Miraval, that pain is the number one thing number one reason why patients seek out acupuncture from me in general. So that is like hands down the number one reason, and also the number one reason why providers like yourself refer to someone like me. And so the thing about acupuncture in terms of pain management is that there's a lot of growing evidence for acupuncture in its ability to reduce inflammation. We know that inflammatory markers get reduced. We know that acupuncture helps to kick out our endogenous opioids, which we know are our natural pain blocking mechanisms. And it helps to also, so with pain, we know that there's no separation between mind and body. And so the more pain someone is in, perhaps the more stressed and anxious they are. And so we also know that pain is really beautiful with helping to kick out serotonin, which, if you're not familiar with that term, it's that well-being feel-good hormone that people have. So it's like this bubble bath of all of these like wonderful neurohormones that are being released from the brain, really helping people and and I don't want anybody to think that it's this magic bullet. It can certainly help reduce the intensity of the pain, the duration of pain, the impact of pain from a quality of life perspective. And so which is really great. And the other thing that I have witnessed clinically is that when people make the decision to incorporate pain into their regular conventional care, which we know is imperative, right? Acupuncture should be used in conjunction with what what their providers are recommending. But so we typically see, the benefits of the acupuncture, but the decision for the patient to incorporate these kind of lifestyle therapies into their care, we know from the research that that it can make a great impact from a general outcomes perspective, because they feel a greater sense of control. Sometimes in a situation where a lot of the control is taken away, not taken away, but you know they don't have. Anyway, so that's what I wanted to say about that.
Sorry, I was muted, but I was
That's
going to
okay.
say, yeah, absolutely. And when you talk to patients and listen to their stories that they experience chronic pain, it could be devastating. It could be something that actually interferes with pretty much every aspect of their
Yes.
life, including sleep. And that
Yes.
becomes a cycle that, if they don't sleep properly, they don't get proper restoration during night, then the next day they're going to be tired. And then fatigue comes,
Yes.
and then they don't move as much. And then spasticity increase, and then becomes this
Yes.
cycle that sometimes,
Mm,
one type of pain leads to other types of pain that are
mhm.
secondary to lack of energy, decreased exercise, and more spasticity related pain. So, you
Yes.
mentioned something about how acupuncture fits into the algorithm of care. What has been
Hmm.
your experience in terms of, how acupuncture compares to traditional pharmacological interventions for pain?
Yeah. So, I mean, so acupuncture, there is evidence to suggest, and I'm trying to find my exact information here. But acupuncture is shown to be sometimes as effective or even superior to some medications, and also with fewer side effects, and a nice safety profile. And so those drugs in particular are NSAIDs, and that gabapentin or amitriptyline, in comparable populations. Um, so it's great from that perspective, because a lot of times there are, even though there's a lot of um, efficacy and help, of course, with pain medications, but the downside of pain meds for many people are the multiple side effects that come along with how they make them feel, mentally, physically, and all of that. So acupuncture has a great safety profile with low risks.
So you kind of explain the different sites and in the insertion of a gentle needle, but what will a typical acupuncture session look like for someone, let's say, that never had acupuncture before and perhaps is interested? Well, if you can probably walk us through what a typical session kind of looks like.
Yeah, no, that's great. So the very first session is typically longer than any follow-up session, just because I like to gather so much information about trying to figure out what they want their focus or their chief complaint to be. And then I gather all sorts of information related to, like, their general constitutional health. So let's just say that they're coming in for a chief complaint or the main reason to address pain. And so of course, I'm going to want to know all of the great details. What is the pain from? How long have you had it? How are you typically treating it? What parts of the body, is it impacting? How is it affecting your quality of life? Again, how are you managing it? What other maybe lifestyle modifications are you incorporating? Are you doing any herbs or supplements? I mean, that kind of stuff people typically leave out of many um, um, uh, like discussions with providers, because that's really important. What makes the pain worse? What makes the pain better? So all of those really great details. And then I'll dial out and begin to ask, okay, so let's talk about, so kind of from, the top of your head to the bottom of your feet, um, you know, how are you, like any issues with, headaches or ear ringing and or eye stuff, and so all of the like the different areas. Sleep, how's your stress, how are your bowel movements, how are your, how's your social support, what is your emotional well-being like, what's your physical activity like, all of that stuff. And then from a Chinese perspective, I typically like to, so remember, acupuncture is a practice that's 5,000 years old. And so back in the day, they didn't have any MRIs or X-rays to kind of see what was going on inside the body. And so from a Chinese perspective, I like to observe the body in a way that most providers don't do. And so I'll ask the patient if they could stick out their tongue. Their tongue from a Chinese perspective can provide some, insight in terms of what's going on from an internal perspective. Um, and then as a result, so then after doing my or asking all of the information, and looking at the patient's tongue, I will then typically explain. I will have come up with an acupuncture prescription or protocol in my head, which can be anywhere from 4 to sometimes to 44 needles, depending on the patient's kind of energetic levels, or like their constitution, like how strong are they. And so if they've never had acupuncture before, I will make sure that I take the time to explain everything, that you're going to lay down on this table. Your head is going to be supported, with this pillow. I'm going to put a bolster underneath your knees to support your low back. I'm going to wash my hands. I'm going to take alcohol prep pads to these areas of your body. I will typically show them an actual acupuncture needle if they're not needle sensitive or phobic. And I'll show them, like, okay, this is the guide tube that the needle is in. Here is the needle. It's really thin. It's really flexible. When I insert it, there's going to be a slight pinch upon insertion. There can be kind of a heaviness and an achiness at the needle site itself. But once the needles are in, ironically, a lot of people actually fall asleep. And so, like, music is playing, the table is warm if people like warmth. I dim the lights. I give them a call cord or a call button in the event that they need me, because the needles are left in for 20 to 30, sometimes 50 minutes. And so they're there, and if they want additional help with, like, I will often offer to walk them through like a mindful breathing practice, something that they can kind of anchor their attention into, which is really nice, or a breathing mantra or something like that. And then at the end of that treatment time, I will come in, wash my hands, glove up, remove all the needles, place the needles in a um, uh, um, what am I looking for? Our sharps container. And then ask if they have any questions, and then we schedule the next treatment. And I do want to share real quickly before I forget, in case it's not brought up, is that while acupuncture can be helpful and can be effective, it is the cadence of treatments, that the amount of treatments that someone has and the consistency of the treatments is what's going to tee up someone for success. And so if anybody is interested in having acupuncture, it's really important that you discuss that with the person that you're seeing.
I think that's excellent. And if I may jump in, because there are a couple of comments and questions that
Sure.
have been put into the Q&A box. And I think just piggybacking off of exactly what you just said, Dr. Lorbeck. So if there's individuals that are asking about if there's like a treatment plan where you're on an actual regimen, and what is ultimately the best strategy that you have used, particularly when MS patients have come in to see you, or individuals with neurological conditions.
So are you asking about, like, what is my recommended, like, dose of acupuncture? Is that the question? Or
I think that it's more asking around a treatment regimen. Like it's not just a one-time in
oh,
to see
yes.
you, that you actually do set them up with a schedule, so to speak, of coming in, and it's a more of a ongoing
Yes.
treatment plan.
Yes, 1000%. And that's a great question. It's very common, and I'm glad it was brought up. So What I've seen clinically in my 18 years, and also what we see in the scientific literature, is absolutely seeing a licensed and credentialed provider on a weekly basis for several consecutive weeks is key. I would say the more chronic and the more severe and the more intense, let's just say that pain management is the chief complaint. If time and money, are not, a problem, I would absolutely say seeing someone twice a week for a good 6 to 8 weeks is probably a good starting point. Acupuncture is not the kind of thing where don't ever let anybody tell you that you have to if you start acupuncture, you have to have it every single week for the rest of your life. That's a bunch of hogwash. If you aren't starting to see the benefits of acupuncture, I would say at least a little something by the fourth treatment. I would say give it a couple more. But definitely between like the sixth and the 10th treatment, you should really start to see something if, in fact, acupuncture is going to be a promising treatment for you. So I would absolutely say that. And then after the end of, let's say, that course of treatments over an 8-week time period, you can typically take, my recommendation is that people take, like maybe a 2-week or a 3-week break. Of course, letting them know that if and let's just say ideally, like, the pain has reduced and we're starting to see some benefits, that we'll let the plan is to take a break, but it's often really important, and people really like to know, like, if I start to feel like I need you, like, can I reach out? Of course, right? But a break is really good. And what's really cool to know is that just because the treatments end per se, let's say at that 8-week mark, the benefits of the acupuncture, we know from the scientific literature and what I have seen clinically, is that the benefits can last 3 months, 6 months. We've seen sometimes the
Yes.
benefits lasting up to a year, which is unbelievable.
Yeah.
Um, so yeah, great question.
Yeah, no, I think that it was, and I would have wondered the same thing as to, how frequently and what is typically not normal, when it comes to seeking acupuncture.
Yeah.
Um, Another question that has popped up here a couple of times in the chat box is, um, dry needling, and ultimately,
Mm.
how does that compare to acupuncture, and whether or not dry needling is good, better, different from acupuncture? What are your thoughts on that, Dr. Lorbeck?
Yeah, no, that's another great question. Again, very, very common. So essentially, so you typically associate dry needling with a physical therapist, right? So if you go and you need physical therapy, they'll often ask if they can do dry needling. Unless someone is licensed as an acupuncturist, physical therapists can't call what they do acupuncture. So it is referred to as dried needling. But the difference, though, is that they're only going, the reason why it's called, well, what they're doing is they are going into muscle motor points in the body, um which my understanding is that those are areas of the muscle that have a higher concentration of electricity. Is that right, Dr. Miraval? Okay. And so that's really all that they're doing. They're just going into muscle motor points to release that muscle. Whereas acupuncture is, we can do those muscle motor points, and we know we're trained to do those, but we don't necessarily call that dry needling. But acupuncture is more of like, we look at the body from a real holistic perspective, and we're not just treating the symptoms per se. We're really looking at someone's constitutional health and trying to utilize these other acupuncture points that can help support the body from a I guess an overall well-being perspective, in addition to treating the condition. Does that kind of make sense?
Absolutely.
I agree
Yeah.
with you. And I think the way I explain that to patients too is I find that dry needling may be helpful if someone has, let's say, a very localized area of
Yes.
spasticity or
Mm,
pain that is usually more musculoskeletal in
mm,
nature. And that's
mm-hmm.
when that, dry needling helps.
Mm-hmm.
Whereas, as you mentioned, Dr. Lorbeck, acupuncture is more of this holistic integration of strategies that usually leads to better results in symptoms that are more systemic, right? So whether it's
Yes.
fatigue or generalized spasticity or generalized pain, in which, of course, you need to have more of an integration of the mind body, as you were explaining before,
Yes.
which dry needling perhaps is not going to be as effective.
Correct.
Yeah, and I can just speak from the standpoint of dry needling. Our son who had tennis elbow, that, for example,
Oh.
that was a very typical thing that the physical therapist would provide. So yeah, this is definitely a very different scenario.
Mm-hmm.
So I saw a
Um,
couple of questions, and just for background, Dr. Lorbeck, our audience continues to be more and more sophisticated. So you will notice that because the type of questions they ask is fantastic, right? And there were some
Fantastic.
questions about, for example, the science behind acupuncture, some questions about references, and what is the evidence behind. So I took the liberty to write on the Q&A an article that actually I think is a good first read for
Oh,
anyone that wants to
good.
read more about the evidence, which is this meta-analysis of 75 clinical trials that were done using acupuncture in multiple sclerosis. And of those, they kind of looked into the scientific evidence and they narrowed down to 31, and they looked into what is the level of results in those studies. And you can, as you mentioned before, acupuncture was done in MS patients and was found to increase quality of life,
Yep.
they would decrease pain, particularly spasticity related pain, as well as improvements in fatigue.
Mm-hmm.
So we haven't talked much about spasticity. So what is your take on the use of, acupuncture in generalized spasticity, and what have been your results?
Yeah, so unfortunately, and again, I did not do a deep dive, into the literature. And I will say that, there's a lot that can be done in terms of MS and acupuncture research. I mean, there is a lot that could be done, a lot that can be done. But unfortunately, from, my from what I saw is that there is limited research. They're mostly case studies, um, for MS. But when it came to looking at those individuals who've had stroke, there was more of a moderate quality of evidence that showed that electroacupuncture, which is e-stim, combined with rehab, can reduce spasticity. But and in these particular studies, treatments were often done daily, or multiple times a week, with the treatment sessions being 30 to 40 minutes. But again, this is not I did not do a deep, so, a deep dive. So please know that.
I
I
understand.
hang on one second. So just so that everybody knows, we were having some technical issues before I hopped on, and I wasn't planning on using my phone. I need to go plug my phone in. So if we could just give me 2 seconds to go get my charger, I'll be right back.
While you do that, I'm going to just maybe review some of the studies that actually were done that are more provocative questions, which has to do with the use of acupuncture as a way to not just simply affect symptoms, let's say neuropathic pain or spasticity or fatigue, but actually acupuncture as a way to affect the biological processes that are involved in multiple sclerosis. And, as you can imagine, those studies are the evidence behind that is less strong, just simply because not one intervention is probably going to affect these very complex biological processes. Having said that, One area that I think might be of interest, and I hope the field continue to evolve in that area, is acupuncture as a way to enhance a neurotransmitter called BDNF, which is a brain-derived neurotropic factor. This brain-derived neurotropic factor is a factor that is released in the brain whenever there is growth or whenever there is an attempt of the brain to repair. So that area perhaps is more thought provoking in terms of saying, well, can we through these interventions, and the same is being done with other type of holistic medicine. Can we also enhance the way in which the brain repairs? So I think we are far from being able to claim that acupuncture induces brain repair, but I think speaks to the fact that many of the lifestyle interventions that we recommend, if any, may reduce stress, if any, may reduce, all of these other factors that actually contribute to, an increased state of inflammation. And I see that you're back, so hopefully your cell phone is charged now, so we don't lose you in an
Yes.
attempt to to navigate these challenges, these technological challenges. Kathy,
Yes.
any other questions from the audience?
Yes, and I'm not surprised to see this one. Ultimately, it comes down to whether or not insurance covers acupuncture and Medicare in particular.
Yeah. So yes, very, very common question. It's my understanding that Medicare, at least for now, covers acupuncture for the chief complaint of chronic low back pain. But the low back pain cannot be related at all to cancer. So, and I think they cover up. I, I think they cover. I don't know. I mean, maybe like 16 treatments or something like that. And if there's evidence that the acupuncture is um, providing good results, I guess there's a few more that are that people can have. But if you are interested in knowing if acupuncture, if you have insurance coverage, unfortunately, it would require that you call your insurance company. And then if they do have coverage, you could always ask your acupuncturist for a super bill, and the super bill will provide all of like the codes that the insurance would need to reimburse you. Some acupuncture clinics actually accept insurance, so they will, they can do all of that investigating for you. But yeah, that can be a little bit tricky.
Just did a quick search online, and you're correct. It does cover for the chronic low back pain lasting at least 12 weeks and covers up to 12 acupuncture treatments
Oh,
in
12.
90 days for chronic back pain.
Okay. All right. Thank you.
So I guess, Dr. Miravalle, you have to put in a referral for lower back pain.
Like that's the case, right? So that's the challenge that we have. So if the intervention is used for other indications, unfortunately, we can't. So what are the other ways in which patients can access your services or acupuncture services in general?
So at Rush, I am limited to seeing people with a cancer history. So they need to be patients at MD Anderson Cancer Center. In my private practice, I am open to seeing anybody. Unfortunately, I do not accept insurance, but I am very this is one of my life's passions is providing acupuncture, and so I am more than willing to work with people from a financial perspective. So. And I can provide you with a link to my website afterwards if people are interested.
Wonderful.
Well,
Yeah,
speaking of referrals and use in the clinical practice, so what has been if you can tell us maybe a story that was successful, so we can learn from, when to incorporate acupuncture, but also a story that is like, I've tried everything I could, and unfortunately, didn't work. So that perhaps will give us a framework to think around, what will be an ideal candidate to consider acupuncture, and perhaps what will be not an ideal candidate for acupuncture.
Yeah, that's great. So, number one, I think, and this is something I just recently gave a TEDx talk that's not out just yet, but one of the things that I talked about in my TEDx is one of the most heartbreaking things for me clinically in my 18 years at Rush is that patients will and again, this is, I'm just referring to cancer patients, not um um but one of the most heartbreaking themes that I've experienced clinically is that patients often say, why didn't I know about you sooner? Why did I not know about your supportive oncology sooner? Why does everybody wait until it's a last ditch effort to refer to you? And so number one, I would say, if and this is also for patients and caregivers to be broaching these topics, right, with their healthcare providers. And I also realize that, our healthcare providers unfortunately don't often have a lot of time to broach these topics of lifestyle, of lifestyle therapies, and so there's a lot of barriers to even having that conversation started. So, but as much as we can, if we can, at least, try to weave in, and it sounds like, I mean, with all of these wonderful programs that you guys are doing, that is now a big focus of yours, which is really wonderful. So that's great. Um, and I saw that, and I forgot what you asked.
Oh,
Um,
that's helpful. I think you alluded to that in a sense that is perhaps what I'm hearing from you is earlier in the process is better
yes,
in terms of
earlier is
referral.
better. Yes,
Okay.
absolutely. Earlier is better. And again, not to be used as an alternative to your, medical therapies and services and that sort of thing, but to be used as an adjunct to, what you're doing. And I will share with you that, acupuncture has, again, a very high safety profile when it is provided by people with the appropriate training, education, background, and experience. And so for anybody, on your call, and for you also as a referring provider, I mean, that's really important to to be able to ask that question, of people that you're going to refer to. But apparently, for in terms of contraindications or cautions for people with MS, I guess it should be avoided during acute flare-ups, during active infections. It should be, people should not receive the electric stimulation if they have a pacemaker. If someone has a bleeding risk, you know, I, I wouldn't necessarily say that it's a contraindication. I always look at my patient's lab values, and if bleeding is, if that's, I feel like, could be a concern, I always reach out to the provider ahead of time to get permission. And certainly if someone is pregnant, acupuncture isn't contraindicated, but there are acupuncture points that we have to avoid, to not kind of create problems. And then there's a whole other host of cautions and contraindications in people with cancer, but I know that that's not who we're talking about tonight. Um, so yeah, but to your point, early on in the conversation, early on, in treatments, I think is really important,
Absolutely. And sometimes I think that we as healthcare providers get into the habit of, if let's say pain management, if one pharmacological intervention doesn't help, we often move to the next one, and then sometimes we move to the next
Sure.
one, and right, that inertia of keep trying, medications
Hmm.
sometimes prevents us from thinking outside the box and saying, well, you've already tried three pain medications. Rather than keep going up on the dose, can we try acupuncture, right? So I think that's
Yes.
that's probably on us as well, of saying, let's just include this as early as possible. But to your point, so when you see patients that perhaps come to you and say, I've tried that already and didn't work, what are the usual factors that, in your experience, perhaps led to that lack of efficacy?
Can you kind of rephrase that? I don't understand.
So, often when I recommend some of these interventions, and that applies to acupuncture, but sometimes to physical therapy, patients often say, "Well, yeah, I've tried that, but it didn't work."
Mm-hmm.
And I find that there are many reasons why perhaps that's the case, right? So I
Mm-hmm.
can
Mm-hmm.
speak on physical therapy that usually is because either the physical therapist was more focused on orthopedic or joint issues as opposed to neuro issues.
Got it.
And that's why I always remind people, well, there are different types of physical therapies. Make sure that if you go to a physical therapist, you go to the right one, which is a neuro
Yes.
PT. So
Yes.
because they will focus on the issues that perhaps you want. The second advice I always give patients is, when you go to a therapist, know exactly what you're hoping to achieve.
Yes.
And sometimes when I recommend acupuncture, I often get an answer say, well, I've tried that and it didn't
Yeah.
work.
Got it.
So in your experience, what are the reasons that perhaps you can share with us of why perhaps acupuncture didn't work, but you might still recommend to try it one more time?
Sure. Okay. Thank you for restating that. So, yes, and I've heard that a lot of times too from patients. No, I tried that. That didn't work. This didn't work. So the thing that I remind people is, and again, I shared this a little bit earlier, is that the number of treatments, you can't just have one treatment or two treatments and think that it's going to work. I mean, you really do have to give acupuncture its best shot, no pun intended, but again, weekly or bi-weekly appointments at a minimum for 6 to 8 weeks, period, end of sentence. Don't even waste your time or money if you do, and the thing too is that, I mean, a lot of times when people come to see me, I'll, during my first discussion with them, I'll say, okay, so if you were to wave a magic wand and I could, be of the greatest and biggest help to you, what would you want me to treat? And they're like, oh my gosh, I have this and I have this and I have this and I have this and I have this. And there's, you know what I mean? There's like lots of things that we could address. The thing with acupuncture is that it's really important that we stay the course. So let's just say that if it is some sort of pain, that we aren't changing the treatment every single week or every single session that you come, that we are focusing on the actual chief complaint, from the very beginning, and really kind of stay the course. But I want people to know too, and I'm going a little bit off topic, that even though we're addressing typically a chief complaint or maybe a secondary complaint, the side effects from the acupuncture can often be really amazing and beautiful. Better sleep, better digestion, reduction of stress, just this overall sense of well-being, and you just feel like you can meet your day with a greater sense of, I don't know, grace and maybe self-compassion. Um, so I guess that would be my thing. And the other thing is that, to your question, is that let's just say that someone ends up having acupuncture and they've had a course of acupuncture over a series of weeks, and all of a sudden they're like, I don't know what happens or what's happening in that treatment room, but I am feeling amazing. And so what I did is I painted my entire house and I started training for a marathon. Like, no, do not undo my treatment. So that's the other thing, is people kind of, they get excited because they start to feel better and they start to be more active, and maybe it's a little bit too much. And so you kind of have to have a little bit of balance. So I guess that would be kind of my words of advice.
I think all
Excellent.
of us listening are probably say, sign me up.
Yeah,
This
right. I
sounds
know.
wonderful.
Yeah.
Well, and I do want to lean on just real quickly. Sorry, Dr. Miravalle, if I'm interrupting you. You mentioned even sleep, that it helps improve sleep. And so there was a question actually in the chat box
Mm.
whether it could help with sleep apnea.
Oh,
Oh no.
I don't know. I've never treated anybody for that. And I've never needed to look into anything like that into the literature.
Mm,
It's a
okay.
great question, though.
Yeah. Well, maybe if I could touch on some of the other questions that have come through. Is that okay with you, Dr. Miravalle, as well? Yeah. Um, and I think many of us are somewhat curious who have never experienced acupuncture as to what type of, and you touched a little bit about that on this, what type of sensations do patients typically describe during like the first,
Mm,
30 minutes after needles have been placed, and whether there's any pain involved in the process.
yeah, that's a great question. So the initial insertion, there can be, not always, there can be a little bit of pinch upon insertion at the needle site itself. There can be a heaviness and an achiness, probably the circumference of about maybe a nickel, or a quarter, again at the needle site itself. But after 30 to 60, I would say 20 to 30 seconds, that sensation, that initial sensation of the pinchiness, of the heavy achiness, begins to dissipate. If someone accidentally moves during the treatment, let's say they you know how sometimes you take a nap, you fall asleep, and your body jerks a little bit. So if they accidentally do that, it's not they're not going to harm themselves. But when the needles move in the muscle, with any sort of automatic movement, there can be it can feel a little bit startling. It can hurt a little bit. Again, you're not going to harm yourself. There's nothing wrong, but it can just be like, ugh. Um, um, but so that's kind of it from a sensation perspective. I will say, and not to be like woo woo, but I will say that some people say that they kind of go into like a really kind of deep, really nice grounded meditation, that they find that their breathing is really, just really grounded and centered. Some people, not a lot, but some people, like, have a tendency, because they have their eyes closed, have a tendency to see colors. I'm not sure why. You would know more than me. But so that's kind of it from a sensation perspective. But I will say, after the needles are out, people often feel, and again, this is, I think, from the serotonin being released. It literally sometimes feel like, we call it like an acupuncture high. Um, you feel really grounded and like, oh man, this is so great.
No, and I'm glad you bring up the more the mind body connection conversation, which is, I think, in medicine, one of the mistakes that we make is just concentrate and focus so hard on the scientific evidence on what we
Mm,
call organic problems, right? Which I think is
mm,
super important. But at the same time, I think in that attempt, we may underestimate the importance of also wellness and mindfulness
mm,
and meditation, things that actually are techniques that are now starting to show benefits beyond just well-being. I always remind myself that the brain is one of those organs that we learn in med school, that you're born with X number of neurons, and there is little you can do to increase the number of neurons, with exception of few areas in the brain. One is called the hippocampus, and that's the memory center. It's deep into the temporal lobes. And in the hippocampus, neurogenesis, which is the production of new neurons or development of neurons, is possible. And that's how one of the ways that we learn new memories. And so one of the strongest activities that actually we can do to enhance neurogenesis in the hippocampus is mindfulness and meditation.
mm, mm,
Others are exercise, of course, and that's why we are so big into exercise here. And the third one is music. So I think
mm.
we need to continue to emphasize the use of these interventions, even though may not be directly linked to a physical biological benefit, but it's something that actually, if makes people feel better and have better quality of
Yes.
life, I
Yes.
think by itself is beneficial.
Yes, 1000%. And And you know, to your point, and I'm really glad we're kind of ending on this, is that, you know, I've given tens of thousands of treatments in my 18 years to people as young as 5, you know, the young span of 5 years old to 96, 97, 98. And and the thing that I've heard over and over and over is that people, when people have acupuncture, you know, they experience a greater sense of hope. You know, and I feel like when people have hope and when they feel like they have a greater sense of control and feel more empowered, and they also connect with the provider, that whole patient provider relationship too also contributes to the healing. And so, you know, with me, my very first session with patients is 90 minutes. And so a lot of that is the intake and then the treatment, and then, you know, and then follow-up sessions are an hour. So I've had the lovely opportunity to be able to spend a lot of and get to know my patients and build and gain their trust. So all of that, what you're saying is so important to healing.
Well, I'm gonna stop asking questions. I know we're getting to the end, but I just want to say, Dr. Lorberg, thank you for being here, for educating us in the area of acupuncture, which is an important one. I hope that as we continue to build the Brain Health Center, we can actually build resources so we can offer this to patients, even those without insurance. I think it's an important modality in our care that again, will de-emphasize the use of certain pharmacological interventions, particularly for pain management, that they could have terrible side effects, and perhaps remind us of the use of certain interventions that are ancient interventions that are actually safer and perhaps more effective. So thank you for what you do, and I'm going to pass it on to Kathy to end the meeting.
Excellent. Well, I will agree with Dr. Miravati. This has been fantastic. And actually, I think it's also answered a lot of questions that I personally had around acupuncture. It's listening to you and how you spoke about it makes it sound like a really beautiful treatment, and something that has minimal, if any, side effects. So thank you for teaching us all a little bit more and informing us of the beauty of acupuncture. And it was super nice to have you with us this evening, Dr. Lorbeck. It's been an honor. Thank you for educating us all. And yes, on that note, I am going to give an update on our final session for our summer series, which will be Monday, August 11th, where we will have Mindy Eisenberg from Yoga Moves MS. She's been with us previously, but happy to bring her back as part of this holistic medicine summer series. So she will be talking about mind-body stress reduction through the use of yoga. So happy to have her join us. Again, that is going to be Monday, August 11th. And just to kind of wrap things up again from Dr. Kaplan at the beginning, anybody who is indeed interested in participating in our 3-week masterclass, brain health masterclass for multiple sclerosis, feel free to reach out to me. And if there is interest in the CLIP MS study in particular, maybe just make a note either to Jules Skoda or myself if you email us, so that we are aware of that as well. Wonderful session this evening.
Kathy, before
Yes.
I see a question, Dr. Lorberg, could you share your contact information? There are some questions on the Q&A.
Yeah, absolutely. People can reach out to me at Angela_M_Lorbeck, LORBECK @rush.edu.
Fantastic. Yeah, and I can always pass that on as well to anybody who
Sure.
is interested. So feel
Okay.
free to contact me, and I'm happy to pass that along. Well,
Thank you again,
wonderful.
both, so much. This was so wonderful, and thanks to your community for their questions and their attention and in this particular topic. Thank you so much.
Yes. Well, hope everybody has a wonderful evening and hope to see you for our final session on August 11th. Enjoy summer, everyone. We'll see you soon. Take care.
Bye-bye.
Bye.